Assalamu alaikum wa rahmatullah. Okay, this is a case where we had a consultation where the patient has pain. صح? Okay. So
Tender to percussion.
tender to percussion and pain in the 6.
Yes.
Okay. Now, this is the 7, 6, 5, and 4. These are treatments, previous treatments. The marginal seals, I'm not really happy about them. Here, what do you have? What do you think here is the
I guess
present?
post.
I guess a post, but these would be the old systems, because the new systems now, they put a wire for radio opacity. Okay, so marginal seal is not is imperfect. These are connected with each other. These should be separated. So my advice here is to remove these, reevaluate, and try to remarginalize. If you might need crowning thing to save this tooth. Taking that, the opacity, the length of the filling is okay. The quality here, this 1-2 millimeter, it's not the best.
Yes.
Not the best. Okay. The quality here, the opacity is not very good. I would repeat this endo. Okay. But it needs re-evaluation. No, why I'm registering this video because of this. Just a quick note. Do you see the flare up of the roots? This will be a difficult extraction if it's going to be extracted, okay? So this is a case to anticipate. Sectioning would be better, okay? If you need extractions.
Yes.
But this is a good case showing the flared roots with some molars that can be difficult for the extractions. Okay, so this is the concern. This is where the tender is tenderness of percussion. Why I've registered this video? Because I pointed out the density of the dentine. Look at the density of a sound tooth. Okay, this is continuous. But here, what do we have? We have a dense, and some hollow, something here. We have an amalgam filling. This amalgam filling is shallow.
Yes.
It doesn't induce any problems. Okay, what might have happened? The marginal seal, it might not be the best, but still, I don't see secondary caries. Why is it? So what is the problem here? Why is this tooth infected? If you look closer, something is appearing here as if it's a radiolucency. I'm not sure. I could not see in between roots, but see this large bubble. Okay, I'm just keep it in mind. But the idea is here. So I have this is the pulpal area, and something is going out here. What might this be? Okay. First of all, you want to confirm the vitality of the tooth. Okay. With 3 rooted teeth, it becomes more difficult because it might be one root is non-vital and the others are vital. But you're going for endo-eyes.
Yes.
Okay. I would, in this case, for me, if it was me, I would do the following. Because of this density discrepancy, I might suspect that something was put here and then this amalgam was put over it. So something as a base. And this might have had some mummification.
Okay.
Mummification agents. What are these? These are a paste that contains formaldehyde or similar material. They do mummification of the tooth.
Okay.
Similar to what we do in pedo. But
yes.
for macrozome, how much do we leave it on the tooth? Very minimal, just to stabilize the tissue coronally. But once you place the material and leave it, so it mummifies the whole root. Okay. These are not acceptable practices. These were usually done previously, but still there are some dentists doing this. So for me, if it was me, I would remove this filling, explore this area, see if it's a filling or something else. If it was a filling going through, and definitely it would be a test cavity. I would not put anesthesia there, and go through and reach and see where do I reach. So if suppose there is a material here, I would go through it, keep going until I expose the roots. Once I expose the roots, I might find an empty pulpal chamber. This is an endo, definitely. Okay. Suppose there's nothing. This is only dentine, sound dentine. I would remove this. No. I would remove this. If this was sound dentine inside, in the middle of the cavity.
Without caries, you mean?
Without caries or not any mummification, just maybe it was just contrast, something happening here.
Okay.
I would leave it, do better or more thorough vitality tests for this tooth. Okay? I could not see anything causing periapical lesion. A bit widening here. Is this sufficient or not?
No.
Let me see. The vitality test should pick this up. Okay. So I do vitality test. Are there any symptoms of irreversible pulpitis?
Yes. In the eyes, painful. Tears.
On this tooth?
Yes.
Okay. If it's signs of irreversible pulpitis, I would go for endo.
Yes.
Okay. So clinical signs are the most, and I'll do test cavity as well. But from the endo-eyes alone, for me, just the endo-eyes itself, I would I would not prefer not to rely on it in the first time. Why? Suppose there was an occlusal trauma. It might be the reason, صح?
صح.
Okay? Suppose the patient had a crack in the tooth. It might be a reason. So all of these, I would like to repeat the test further before doing the endo. Or use electric pulse test, or use test cavity, just to confirm. So it's not only the endo eyes that I would like to look at.
تنصحيني احولها على عيادة
The
الاندوماستر.
endo vitality testing, thorough vitality testing, and check there are no cracks, there are no occlusal trauma in the close couple of weeks or couple of days even. Okay, thank you.